Oh, let me just stop the slides. Good evening and welcome, everyone. I'm Claire. I'm editor on Medical Chronicle. I'm joined here by Riali Ruiz for her presentation on the facts about specialized sports strapping and when to use brace support. This webinar is sponsored by Essity. Riali Ruiz is a registered physiotherapist who has a master's degree in sports physiotherapy. She has a special interest in musculoskeletal injuries and has traveled and worked extensively in the sport field since 2015. This includes South African wheelchair basketball physiotherapist, traveling to the World Championships in 2016 in Toronto, Canada, the University of Johannesburg Rugby, University of Johannesburg Rowing and Athletics, and the University of Witwatersrand Rugby and Wits Hockey, as well as soccer. Riali's main aim is to drive quick recovery of her patients so they can resume their normal way of life without major pain and injury. This applies to both those suffering a sports injury or something as simple as sitting at a desk all day, which we all know hurts us, just sitting. So I'm sure it's bound to be an interesting webinar. Just some guidance for you. If you have a bad connection, there's a box at the top of your screen that says reconnect. Please click the button if you have any issues. It'll bring you right back into the webinar. There will be a recording of this webinar to watch. You'll receive the link via email after the webinar. And to let you know, tonight is something different. It's a product webinar, not for CPD points. It's going to be interactive and informative. I'm going to hand over to Riali shortly. While I get her presentation ready, please type Y for yes in the chat section if you would like to be added to Essity's attendance register for tonight. And feel free to ask questions in the Q&A box, which is next to the chat box. It says Q&A only. Okay, I'm going to start your slides for you now, Riali. Oh, hang on a sec. Here we go.
There we go. Good evening, everybody. Thank you, Claire, for the introduction. I don't think I have to introduce myself a lot more. Thanks, Essity, for allowing me this opportunity to be able to present this webinar. I've been very excited working on it. And if I can reach quite a lot just teaching them about specialized sports strapping and when to use a brace, it will be awesome. So let's get going. So first, we're going to look at what is this aim of this presentation. So the aim of this presentation is to allow everyone attending this presentation to have an understanding about the concept of sports taping and when to use brace support. So let's look at sports taping. So I would like to know which types of strapping products are actually available within the Leuco S sports range. So we're going to run a poll and Claire's going to put it up for us and you guys can answer it now. Right, so I saw some answers are rigid, EAB and kinesio taping. So we're going to discuss it further quite now and then we'll carry on. So what is the definition of sports taping? Sports taping is defined as the process of applying tape directly over the skin or using an underwrap to the skin to maintain optimal joint positioning. So what is the objectives of the taping? Firstly, the objectives of taping is to understand the indications for sports taping, to understand the basic principles around sports taping, to understand the different types of sports taping, which we had the poll on, and then also to understand how effectively to apply and remove sports tape. So what are the indications? When are we going to actually use sports tape? So sports tapes can be used within an acute, a subacute, as well as an injury prevention phase. So within the acute phase, when you have a recent injury that happened, we're first going to use the taping to protect, immobilize, ice, and compress this joint because you can ice over the taping. You can use it for pain relief as well as for allow optimal healing. So in the subacute phase, after you've got the recent injury, about 2 weeks after the injury, you can go to the subacute phase, where you supply additional support to the injured area and you provide protection to the injury further. You also limit unwanted movement, allowing stability, and also encourage proprioception. So for injury prevention, you can use taping to prevent a re-injury, to allow for proprioception, to encourage it, and also allow for player confidence. So what is the basic principles? And let's start around what's the benefits of strapping, because you're going to strap and you want to benefit out of it for your patient. So the first thing is you want to reduce pain and also aid in recovery. Then you want to reduce strain on the affected muscle or muscle group. You want to prevent any harmful range of motion, allow dynamic support for optimal joint positioning as well as postural positioning, correct the joint alignment. Then you also want to provide some dynamic support to hypermobile joints. You want to enhance the biomechanical posture of your patient. You want to restore mobility through proprioceptive feedback. You want to correct mobility, and therefore you'll actually have less pain. You want to normalize muscle function, allow recovery for overuse injuries and other injuries, and then you also can vary the tension over the affected area. The great thing about strapping is you can have immediate effect if you apply it correctly. You want to be patient and injury specific and adjust it according to your patient. Don't just adjust it according to what you think is right. You need to listen to your patient. It's also going to improve your clinical outcome. It's going to help you facilitate rehab. It allows for treatment between treatments while you don't see your patient. And also you have a faster return to sports. So let's look at the therapeutic effect. So therapeutic effect can be in 3 categories. You can have psychological, we can provide structural, as well as neurosensory. So this becomes like in normal life's maths, we can also do our maths within the strapping area. So firstly, you provide conscious awareness. That is going to be your psychological effect. Secondly, you're going to give that proprioception and stability, which is going to provide you stability. And then now you know that the strapping is on and you can do activity without fear, and that gives you our neurosensory input. So further, we're also going to look at the therapeutic effect proprioceptively. So that's going to help us with poor posture and also allow to protect healing tissue. So the first thing is when we structurally apply the taping, we provide mechanical support, which is through the taping. Then you have a continued and uninterrupted stimulation, which is then going to enhance and protect your range of motion. Further, it's going to protect the healing tissue. It's going to stimulate for allowing for structural adaptation. And then finally, it's going to improve your posture and abnormal biomechanics. This is then at the effect going to help with your proprioception. So the whole process. So what causes this proprioceptive dysfunction that I tell you about the whole time that strapping is going to help you with? So the causes, there's 6 main causes that we can look at. The first thing, it's injury, pain, physical dysfunction, inactivity, poor training methods, and neurological disorders. So what is this patient going to present with you? What's this muscle not going to be able to do? So it's not going to be able to protect the joint. It's going to they're going to have instability over the affected area. It's going to need that you can have a re-injury, and they can complain about re-injury. They're going to have poor posture, and then they can also, further, if you carry on, they will not be able to adequately return to sports. So then your strapping is going to provide absolutely the opposite, protecting the joint, providing stability, protecting the affected area, maintaining the posture, and allowing for adequate speed to return to sports. So now I've spoken all about this taping, and we said that there's rigid, EAB, and kinesio taping within the range, but what do I choose and when do I go it? So when you want to choose this tape, you need to understand what's the aim and what's the reason why I'm strapping my specific patient. So why am I taping this patient? You need to then choose the appropriate side for the injured limb and the size of the athlete. You cannot go and strap with a thumb strapping an ankle. You need to choose the adequate, and vice versa. You can't go and use 100 millimeters EAB to to strap an ankle. That is not the adequate size. Then you need to choose the appropriate for this patient. Then you also need to understand the sporting code. Right. So, looking at the different types of tape, we can have rigid tape, and rigid falls under the Leuco-P as well as sports tape. You can have fixing mall, EAB, as well as K-tape. So, let's first look at rigid taping. So, rigid taping, you're going to see on your corner, it's the brown tape. So, your rigid tape is going to have a high adhesive power and tensile strength. It's got a strong backing and it's going to secure fixation under stress. So, with your rigid, you can use it over the skin, but sometimes people do develop allergic reactions, and also it often doesn't stick immediately. So what you then do is, if you look at the corner, you can see the white roll. That is called a fixing mall stretch. And this fixing mall you're going to put underneath, which is breathable, and it's going to allow to prevent allergic reactions. And that is the fixing mall. Further, you can also look at sports tape, which is the white roll demonstrated on the screen. So that has a high adhesive power. It's got a rigid cloth, secures fixation under stress. And it then also sits firmly on the skin as well as on the underwrap. So then further, we also have EAB or elastic adhesive bandage. So they vary in sizes. So you can see from the smallest box, that is going to be a 25 mil, and you're going to go up to 100 mil. So the range have a 25 mil, a 50 mil, a 75, and a 100 mil. And as I said to you guys in the beginning, you need to choose the appropriate size. So you're going to choose the appropriate size of these strapping according to your patient, and you're going to be very, very patient specific. So it's made from high quality extensive cloth. It maintains the stability of an injured joint or ligament. It remains firmly in place, and it's got a central line which allows you for overlapping to know exactly where to overlap. Then we also have K-tape. So, looking at the K-tape. So, firstly, K-tape allows the skin to breathe and to sweat to evaporate. It's got good adhesion. It's well tolerated by the skin. It supports for lymphatic drainage. It enhances proprioception, and it helps to reduce pain, to improve active range of motion. So if you look at the sizes of the K-tape, you have a 25 mils, you have a 5 mil, as well as a 75 mil. There again, you need to choose the appropriate size for your patient. So now we're going to decide, we've seen all this taping, we need to now decide, how am I going to apply, what am I going to assess the patient, because you can't just decide this patient's walking into your room or on the sports field and you feel like strapping today. So before you strap, there's a few things that you always have to remember. So these things, you need to answer these following questions in your head. And they go as follows. Has the injury been assessed thoroughly? What is the comparable sign? So a comparable sign is if a patient tells you, I've got this horrible knee that's feeling very unstable, I can't play with it, you've done your test, the ligaments aren't ruptured, but you feel like you want to provide stability to the patient. So it tells you the patient's telling you it's feeling unstable, then you tape it. You reassess, ask the patient how it's feeling. He tells you, I'm feeling better, it's feeling more stable. So then you've actually got the comparable sign because your patient has improved. You need to understand the mechanism of injury. So, for example, if you have a rugby player, he had a knock on the side of his leg, which means that the inner ligaments, the MCL, is going to be strained. So now you understand the mechanism. It came from the side, the opposite side, the inside of the knee is injured. So I need to strap the inside. Therefore, you need to understand that mechanism because you just can't go and strap the outside. Then you also need to understand which ligaments have been damaged, like as I told you guys now. So you need to understand the anatomy. You need to understand what tissues do I need to protect and support, which movements I need to stop. So I need to enhance normal biomechanics. Is this patient presenting with an acute injury or is it a long-term chronic injury? Do I need to immobilize this patient or actually can I provide for some movement? What is the main purpose of this taping that I'm applying? Are you familiar with this technique? You can't just listen to the webinar tonight and decide tomorrow I'm strapping a player that needs to go onto the field for training. You need to be familiar with it and know how you're doing it. Then, will the patient be comfortable with this taping? Because an uncomfortable patient is not going to provide you what they need to provide on the sports field. They're going to feel uncomfortable. Do you understand the sporting code? And actually, do you have these material in your practice or next to the field? So, now you've ticked all these boxes and you're happy. Now you need to start preparing. So, you're going to check if the patient is allergic to the tape. And how do you do that? You ask your patient, are you allergic? Then you're going to apply the underwrap if this patient is allergic. Remove excessive hair. You cannot move excessive hair in your practice or your rooms or where you strap with a razor. You cannot shave immediately. You are breaking skin. So you're going to use a clipper to remove excessive hair. Then, check if there's any broken skin or any wounds that you need to cover. You cannot directly strap over it. Please cover it. Then you're going to wash and dry the skin adequately. Remove all oils or creams because your tape's not going to stick. If there's oils and creams sitting there, that oily surface is just not going to allow for sticking. After you've cleaned it, you cannot strap over a wet area. So please dry the skin before taping. So now you are going to apply this taping. Right. So to apply this taping, you need to ensure that the patient and the therapist is in a comfortable position. Allow fatigue. So you can maybe think, I'm feeling comfortable for one tape, but if you get to your 5th or 6th ankle, you might feel fatigue. So you also need to ensure that you who's strapping is very comfortable. Place the injured ligament in a shortened position before you apply the tape. And if the ligament is uninjured, you put it in a neutral position before applying the tape. Use the correct tape, the width and the amount when you apply. If you strap with a rigid, a leukope or sports tape, apply strips in a sequential order. You cannot take that roll and wrap it around a person. You need to take, measure, strip it, and apply it. That is very important. So unroll the tape first and you allow for equal tension. Then apply even pressure, positioning of the limb instead of pulling on your tape. So get the correct positioning, as I said to you a few minutes earlier. Injured ligaments in a shortened position, uninjured within a neutral position. Right. Then allow the tape to run smoothly and do not have any creases because you are going to cause skin irritation and you are going to cause blistering. Flow with the shape of the limb. Educate the patient about the function of the tape and how it should feel. Tape should never be uncomfortable. Ensure that the tape is in a functional position and it's comfortable following your application. And then assess your comparable sign. Is this patient feeling better? Do I have immediate relief? So, now this taping has been on. Now you decide it's time to take it off, or the patient is at home and they need to take it off. So firstly, there's a few things that you need to advise this patient on. So, what does he do when his skin starts becoming painful, itchy, red, or there's blisters? So basically allergic reaction. You need to remove this tape immediately. You dry it and you assess the skin for any allergic reactions. If the skin remains irritated after 24 hours, you refer to a medical doctor and you do not reapply the tape until the skin has been resolved. So until that patient's better. You remove the tape if it aggravates the patient's symptoms. You remove the tape if it's too tight. So how does it look when it's too tight? The patient will lose his normal color of skin. They'll experience pins and needles. You never rip tape off like it's waxing. What you do is you remove it carefully by peeling the tape back on itself and you push the skin away underneath. That is how you remove the tape. Then you also remove it by pulling it careful along the axis of the limb. Tape can be softened in cold water. Hot water is not recommended. Cold water before to help you with removing, or you can use the Leuco tape remover, oil, or any oil-based cream to remove this tape. Check the skin again for any broken areas or blisters, and you apply moisture afterwards. This is crucial to educate your patient about it, otherwise they might present with skin irritations. So, how long can we keep tape on for? So, firstly, if you've only strapped for sports participation, you immediately remove the tape after participating. You avoid leaving tape on. Rigid tape, longer than 24 hours. You cannot use rigid tape for longer than 24 hours. K-tape can stay on for 3 to 5 days. Then, if you use it too long and too frequent, taping can cause skin irritations and the skin can become red and painful. Patient education on this is key because we do have side effects. So the first side effect, and I've said it a million times, you irritate the skin. So you can cause contact dermatitis, which is really, really common. So it's a local skin reaction in response to the tape's adhesive, or it's caused by the high tensile strength while this tape is allowed. Then tape can also slack. So tape can slack over a reactive short period. Therefore, you have to retape to maintain it. But remember, rigid doesn't stay on longer than 24 hours and K-tape 3 to 5 days. So, now we're going to go on to K-tape. So, let's have a look at K-tape. So, what makes K-tape different than other tapes? I mean, we've spoken about rigid, we've spoken about EAB, we've spoken about a fixing wall. But why is K-tape in a world of their own? So, the properties of K-tape is different than that of a rigid or an EAB. So, it's not a conventional sports athletic tapes. It mimics the quality of the skin. It's elastic and it allows elasticity, so they stretch on it. It's designed to allow for longitudinal stretch, about 50 to 60% of its resting length. The glue pattern is a wave pattern. It thickens, and the thickness of this tape is approximately the same as your epidermis. It's comprised of elastic strands, and it's wrapped in cotton fibers, which allows for quick drying, and it's going to evaporate off body moisture. It's got no latex in. It is adhesive, and it's 100% acrylic, and it gets heat activated. So you'll often see after somebody's strapped, you rub on the tape to allow for the adhesive to be improved. The elastic quality of the K-tape is effective for 3 to 5 days. You can apply directly on the skin, and you don't need any underwrap. So let's look at the major functions of K-tape. So the first thing that we're going to do around K-tapes allow for pain relief and space correction. So if you'll see at the bottom there, I've illustrated what is going on. So if an area of the body, let's take for example, we've applied this picture on your low back, on the muscles opposite, so your rectus spinalis. So if the tape is then applied, the place is stretched, so the patient goes into forward flexion, because always remember when you apply K-tape, the area that you're strapping needs to be on a stretch. And then the tape is applied to the skin with no tension. The tape will create like little frills over it. These convolutions therefore raises the skin, which is attached to this tape. This is why the tape then creates a space. So if you look at the second picture, you'll see there's a lot of waves, so it creates space. And that is then going to decrease pain by taking pressure off the nociceptors, which is giving you the pain. And it's also to increase the blood flow and also lymphatic drainage. So the further functions of this K-tape, it's going to facilitate and allow for functional correction. So it can stimulate a muscle. Then it can also stabilize a ligament or joint for correction. So the tape can be used for stability. You can also put a rigid over the K-tape if you even want more stability. Then it can allow for lymphatic drainage over the area, so it gives you the channels. So then it's going to take the exudate to the nearest lymph nodes. And then you can also use the taping for tendon correction, and that is to create an increased stimulation over the structure. Then we can also carry on, there's more. So it can be for fascia correction. So you can allow for into a new position, so fascia release. Then we can also use for muscle correction. The tape is applied to facilitate optimal muscle alignment. And then you can also have mechanical correction, where the tape is used to correct biomechanics and for improve proprioception. So biomechanically, you can use the stretch of the tape to your benefit in order to, for example, if you want to strap a shoulder and you want to pull it back, you can use the elasticity to your benefit to get the shoulders back. So if you look at the different types of taping techniques and shapes, you can use an I strip, you can use a Y strip or an X strip, and then you mainly use the pink fan for your lymphatic drainage. So when are you not going to use the K-tape? There is quite a few. So firstly, when you have poor skin integrity, if you have open wounds or infection, if you have an active or recent metastatic disease, if you have any unhealed scars, tape allergies, cardiac insufficiency or DVTs, and if your patient is on medication, like for example, an acnitane. Right, so now we're going to go on to braces. So in the poll, I would like please to know from you guys, who has ever used a brace for themselves or maybe for somebody else? Alrighty, so the majority have actually already used a brace. So let's go into these braces. So what is the research telling us about braces? So braces is useful for acute injuries, chronic conditions, and also to prevent injuries. It allows for pain reduction, management of swelling, immobilization, stabilization, post-surgical use, and also protection against injuries or re-injury. It works well for mild sprains or strains, for contusion, overuse injuries, or joint degeneration. There is good evidence to support the joint brace use. It's relatively low cost and there's few adverse effects. So, what braces do we have? So in the brand, we have medical, athletic braces, then you have for elderly and the active. So medically, you can brace on support, as well as the children, and you can allow an athletics for sports application. Elderly, you can use the joint degeneration prevention, the arthritics to help with that, and then in the active, you can use the sports to prevent any injuries. So I've said to you, we're looking at the evidence around these braces. So what is the evidence actually telling us? So the effectiveness of a brace supports depends on the type of material that's used and the patient's joint stability and previous injuries. The studies have concluded that off-the-shelf braces have the ability to provide up to 20 to 30% more resistance to lateral blows to the knee, so a knock on the side of the knee, with contusion-fitted braces that even allows for better protection. However, another study have indicated that there is some adverse effects with the braces, and that's literally when you go and use a brace without adequately rehabbing and strengthening your patient. Because you can't just think that a brace is going to forever take over the function of the muscle, and it's not going to provide you proprioception all the time. So you have to adequately rehab with the brace. So, bracing seems to be more used as means of protection current injuries and less in the prevention of injuries. So what is the advantages of bracing? So it is a cost and time effective method, and it provides supports to ligaments and joints. It may provide a degree of protection to lateral blows to the knee, as I showed you from the research. It's quick and easy to put on, and it's very comfy to wear. What is the disadvantages? As I said to you guys, it may affect some performance parameters if it's inexperienced And then also in your less condition, the players that's not doing their rehab, that's not strengthening up, and that's not doing their proprioception rehab exercises. So now what we're going to do, we're going to look at the different types of braces. So we get a wrist brace, knee brace, as well as ankle braces. So looking at the wrist braces, we get a kid's wrist stabilizer with a removable metal stay. We get a wrist carpal stabilizer with a pre-shaped metal stay, an adjustable wrist support, as well as an arthritic wrist support for the elderly, or maybe your patients that's been using a lot of repetitive sports which present with the arthritis. Then we get knee braces. We get kids' knee braces with some open patella, and then we also get an adult knee brace with an open patella. Furthermore, we also get the ankle braces. We get the ankle support one, and then we also get the ankle stabilizer with a crisscross straps, which is within the figure of 8. So, if we look at the variety, you can have the active move, you can have the ankle, knee, and wrist, and this is all the people participating with the braces. So let's look at the wrist braces. As I told you guys, we get the wrist kits one, we get the wrist carpal stabilizer with your metal stay, and then you also get the arthritic knee in the middle, as well as the sports adjustable brace for the wrist. Further, we get the knee braces. I said to you guys, you get the open patella brace, both for the children as well as for the adults. Then we get the ankle braces. So the one of the crisscross is on your left over the topic of the slide. So the crisscross mimics your figure of 8 strapping, so it also provides that benefit that you have a strapping through the brace. And then you also get the normal ankle brace that we know people often use. So what is the practical guidelines around the brace? So when am I going to decide now the patient's going to use a brace, but how do we use it? So you need to give instructions on the fitting and the sizing, and you take care of the brace, and that usually appears on the inside of the product. Ensure that the brace has been well fitted and that's comfortable. The patients with a history of joint instability should undergo proprioception and appropriate strength training in addition to wearing the brace. Brace according to the specific sport code and rules. You cannot participate in contact sports with a metal stay. You need to remove it, so the stay needs to come out. And then the brace should be worn during both practice as well as match play. You can't just use it for one. So now let's go to the fun part. So I've mentioned quite a lot of the basics around strapping and when to use what and giving the basic principles around it. But let's think about it practically. Right, so we're going to go through 3 case studies and we're going to start with our first one. So the first case study is Kaylin. So Kaylin is a 19-year-old netball player. She plays netball for a university. She sustained a mild lateral ankle ligament sprain during her netball training on Saturday. On examination, this is how Kaylin's ankle's looking. So it's a nice bruised lateral ankle. So you decide to strap Kaylin, and you also decide to apply a brace. So what will be your choices? So the first choice is you're going to use your K-tape, which you're going to allow for lymph drainage and allow to assist her just to get rid of all that swelling coming around. But you also want to use the price concept. So you want to provide protection, you want to rest, you want to immobilize or you can ice, you want to compress and elevate. So you apply the brace width. So you're going to protect with the brace, you're going to allow for rest, you immobilize, you can ice up on top of it, it gives you compression, and then you can educate her on elevating. So you're going to use your K-tape as well as a brace. So Kaylin is now getting better. After her rehabilitation, she's done her strength training as well as her proprioception. Kaylin is ready to go back to sports, and you decide to strap Kaylin's ankle. So with this recent injury and after rehab, and now Kaylin goes back to sports, because you want to provide stability, you are going to use a rigid taping. So you decide to strap her a figure of 6. So if you look at the demonstration, your figure of 6, you have underneath your fixing mold to prevent this hypoallergic reactions, because Kaylin has a bit of allergic to taping. You go around, you form your first basis, and then you go and you form your 6, which is on your right side, and you can see the strapping coming over and across. But now, Kaylin also wants her uninjured ankle to be strapped as well. So she asked you to do a preventative strapping. So for preventative strapping, you decide to use an EAB, and you decide to use a 50 mil, because the 50 mil is the appropriate size for Kaylin, and you strap her in a figure of 8. But now, after a long time, Kaylin is tired of strapping, and we said that you can't continuously strap over, so she decides that she would prefer a brace to train with. So she also noted that a lot of her teammates are using ankle braces. So then you're going for Kaylin's injured ankle, you're going to advise her to use the ankle brace with the crisscross and figure of 8 strapping to provide more stability. Then the second case we're going to look at is Reinhard. Reinhard is a 17-year-old rugby player, and he plays rugby for his school's first team. He has ruptured his ACL during the school league's final game of the season, and he consulted with one of the doctors in Johannesburg, and he had an ACL reconstruction done. Following the surgery, Reinhard is now at your practice to start his rehab. After his second session, you decide, this knee is still being swollen and I'm not getting these quads to activate. Because we said you can facilitate muscle activation with K-tape. So firstly, you decide I want to assist with the swelling. So you're going to use your finger strapping, which is illustrated with the blue strapping. And then I also want to activate my quad, and you're going to use it with the Y strip that's within the black strapping. So you've put his quad on a stretch. You start from the origin to the insertion, and you went around the patella. So that is how you start to facilitate the quad contraction in adjunction to your rehab. So now Reinhard's ready to go back to sports. So after 9 months, he's completed his rehab. He's been with the physio, he's been with his bio, and everybody has cleared him to be able to go back to sports. So he's asked you to strap his knee. So he's ruptured his ACL. He hasn't injured his medial or collateral ligaments. So medial or lateral collateral ligaments. So there's no point of strapping the ligaments at the back. So you need to provide stability with that for the ACL. So you need to prevent excessive rotation as well. So what you're going to do is you're going to start with the first picture, and you're going to put your fixie mold. You're going to strap underneath the patella, mid-patella cross, and you're going to go back to the back of the knee and activate the hamstrings as well with the rigid strapping. Following after you've strapped, you cover Reinhard's knee with an EAB on the far right, and then he is ready to go and participate back to sports. So Reinhard returns to your practice 3 months after returning to play, and he complains about swelling on his knee after he took a slight knock on his knee. You've assessed him, all ligaments are stable, the meniscus is stable, so he only has a contusion. So you recommend a brace, which is going to just assist with the contusion and also with another blow to the knee. So you give him the adult open knee patella brace. So the last case study that we're going to look at is case study 3. So she's Susanne. Susanne is a 32-year-old social tennis player, and she's been complaining of ulnar-sided wrist pain that got worse over the past 1 month. So it just got progressively worse. She also noted some weakness in her grip strength with slight instability and clicking of her wrist. Following the assessment, you have diagnosed her with triangular fibrocartilage complex injury. So you'll see on the bottom there's anatomy of your TFCC. All right, so now you want to strap her. So after your assessment, you decide to strap Susanne. So you first decide to use the rigid taping. You go Remember, you do not go with the rigid or fixing more completely around. You can go with EAB because it's got some elasticity, so it allows for some breathing space. But with the rigid, your Leuko-P as well as your sports tape, you do not go around completely. So you go and provide some stability on the ulnar side, and you go around the wrist, and you can also decide to provide some stability on the radial side, on the thumb side. So that is the way you'll strap her to provide some support. But now with Susanne's second session, she reported that the strapping was great, but she wants it to be on for longer because she was only allowed to keep the taping on for 24 hours. So you decide to strap her with K-tape. So again, why? Because now she can keep the K-tape on for 3 to 5 days. So having the K-tape on for 3 to 5 days, you're going to want to push the ulna a bit back. So if you look at the second picture, you stretch it, you press down on the ulna, and you release it. And that is going to provide Susanne with her support. But now Susanne's back. Susanne returned for her follow-up session after the second session, and she reported that she would prefer something that could even last for longer than K-tape, and also that she can wear when she plays tennis. After a long discussion with Susanne, you decide to give her the Sports Edition wrist brace in order to provide some support to her wrist. So that was absolutely all the studies. I hope everything made sense and it was nice and clear. So this is just a disclaimer that this is my information. And then I would just also like to acknowledge SAT for the opportunity for allowing me to present this strapping course. Claire and Kilroy, which I started out and developed my love for strapping, and she developed my interest for strapping. And then also everybody that attended this webinar tonight. And there's the references. Thank you.
Thank you so much, Riali. That was very interesting. I would encourage the audience to ask any questions in the chat section or the Q&A only box. Also, I'd like to test their knowledge of some of the things that you said. So there's 2 quick polls that I'd like to do. Have a look, everyone, and please submit your votes on how long you should keep rigid strapping on for. Less than 24 hours, or is it a few days? So I'll give you a little bit of time to answer that. Some movement there. Okay. What do you think, Riali?
I think they've done well. It's absolutely less than 24 hours.
Okay. And then just one more was, okay, let's have a look at this one. Leukotape K can be kept on for up to 5 days. Is that true or false? While the audience is answering, Riali, I was interested to hear that you mentioned you could put a brace over the K-tape. Is that correct?
Yes, you can. So that allows you for complete control.
Okay. All right, I'm going to end this poll. See the results. So there we go. Well done. Well done to our audience. You have taken in some knowledge. Okay, someone's asking about recording. There will be a recording sent afterwards. Yes, absolutely. It'll be emailed to you in about an hour. And I'm trying to see if I've missed any other questions. So yeah, if you have questions, please submit. Something that popped into my mind while you were talking, Riali, was when you were talking about shortened versus a neutral position of when you're doing the tape. Now, if we're talking about the knee, what would be a neutral position of the knee? Would that be straight or bent, or what would that be?
So when you strap a knee, firstly, as I said, the patient as well as you need to be in a comfortable position. So you as therapist might be sitting on the floor in front of the knee, or your patient will be standing on the plinth where you and your patient are comfortable. So the best position to put your patient in is to bend the knee slightly, not more than 30 degrees. So that's the position that you're going to put your patient in. And that's the same for the ACL demo that I showed in the presentation as well. The knees bent to 30 degrees.
Okay, and I suppose the same would go for elbows.
Yes.
Okay. Some comments that the case studies were very insightful, so very interesting. It is interesting because we all get injured. Most of the audience, from what I remember from the poll, have used strapping themselves or on others. And especially as we get older, these things happen. Which resources can we use to read up on how to strap muscles?
So in order to strap muscles, there's quite a lot of taping courses that you can attend. So there's quite a few places that does present strapping courses. There's also K-tape if you want to use for muscles. So, and then also I do remember that SAT had a booklet that also provides some strapping techniques in it. I don't know if it's still available. Marissa will answer that. She can get back to you on that booklet. But mainly there's a K-tape textbook that you can look at and then also attend your courses.
Okay, thank you so much. Someone has asked in the Q&A only box, when you keep the K-tape and brace on, will the 1 to 5 days still apply?
Yes. So you put your K-tape on still 1 to 5 days.
Okay. When do you use a knee brace with a hinge?
The hinge is the one that if there's instability of the joint, then you're going to use your hinge.
Okay, and for a novice like me, how would you know if there's instability of the joint? How would you diagnose that?
So you're going to feel when you walk that knee is feeling like it's going to give out underneath you. And then when it feels like that, you also go and consult your physiotherapist or your doctor in order to get further investigation.
Okay, fantastic. All right. Any other questions from our audience tonight? So, in terms of the patients that you see, are most of them sports injuries, or is it, just mishaps or from sitting at a desk, or is it everything?
So I do see a variety. I do see people that from sitting at desk, long-term posture problems, sports-related, work-related problems, but I do not see any stroke rehabs or any neurological rehab. I don't do, and I also don't treat any children.
Okay.
So that's like developmental problems.
Okay. Would you recommend a brace after a knee replacement?
So if you rehab, yes, you can use the brace for compression and additional support. If you don't rehab and you just use the brace, the patient on the long run is going to get the short straw because it's still not going to give that adequate. The patient will continue having pain.
Okay. Someone is asking, will the information from this webinar be available after to refer back to? That's usually the presenter's call, and you can have a think about it, but sometimes we convert the slides to PDFs, and if you're willing to share, we can share. If not, there is a recording available, but I can discuss that with Riali offline, and we can let you know. So we'll get back to you on that. Let me check if there's anything more in the Q&A only box. I don't see anything. And I suppose in terms of getting hold of these products, you would just reach out to your SAT rep who would make them give you the information you need. What strapping booklet available do you recommend to buy in store? Is there anything that you would recommend to buy in store?
There is a very good K-tape book that you can look at that is available online. I'll just get back to the exact name of the book, but there is a good one.
Okay, excellent. Thank you, Riali. It's been a very different webinar for us, and it's been really interesting and nice to have the interaction with the audience. So thank you so much, audience. If there are any more questions, please feel free. We do have an expert here, so please do ask her. Do you get a lot of referrals from doctors, GPs, or is it mostly patients who just come to you themselves as a physiotherapist?
So it's mainly a lot of physio patients that I see. I do see quite a lot of post surgeries following ACL reconstruction or ankle ligament construction. That type I see quite a lot, but it's mainly your sports physio patients that I see.
Yeah, and I suppose there's also a tendency for people to leave, or if I know myself, leave injuries for a while and try and work out even with them and make my own plan about, helping out my knee and trying to strap it myself with whatever I can find in a sports store, which is really unsuccessful. So, yeah, I suppose it would be better if patients could come to you as soon as they realize that there's an issue that's not really going away.
Yes, for sure, because it needs to be sorted out. Self-treatment is not always the best.
It's definitely not. And I suppose if GPs see that, they really should recommend a patient as well. Does a patient need a referral letter from a doctor to see you for strapping?
No, they can just contact directly and you don't need any referral to come to physio.
Okay. Which tape would you use to aid in lifting a weak foot bridge after surgery?
So it depends on how often you're going to see your patient. You can use a rigid tape, which is going to allow for 24 hours, or you can use a K-tape to lift the bridge. But remember, if you're going to use your K-tape to lift the bridge, you're going to use the elasticity around it. So you're going to strap from the side you want to lift up so that that whole tape can pull the bridge up.
Okay. If someone is going to have an allergy, how soon after you put the tape on does it usually flare up?
With about 10 minutes.
Oh, wow, that's soon. Okay.
They get irritated very, very soon.
Okay. Do you ever do a tester patch or anything like that?
So you usually ask the patient and then they'll tell you, no, I'm not allergic, and then you tape, but then you educate them well enough that if you walk out of here and there's pain or your skin is itching or it's becoming red, you immediately take that tape off immediately.
Okay. So in the chat section, there is a comment. Should anyone in the webinar wish to receive more information about strapping, please contact SCT head office in Pinetown, and we will contact you with guidance on how to navigate our sports and strapping portfolio on offer. And that's from Victoria Sill. Okay, excellent. Thank you. Thank you, Victoria, for that. And hopefully our audience will reach out to you if they need some help and some guidance on the SCT products. Okay, if there's no more questions at the moment, then I'd like to thank you so much, Riali, for your very interesting presentation tonight. Thank you so much to SCT. Here's another question. More questions. Do you have to use an additional adhesive spray to help it stay in place for longer?
So it depends on what your aim is and also how your patient's skin is. So usually, no, it's not needed. But if you are worried that this K-tape or this tape is literally not going to sit, then you do add an adhesive spray. But the adhesive spray, I find it more to use it with K-tape and not with a rigid or an EAB, which is really, really good adhesive for taping.
Okay, this came through as a private question. I know it's a silly question, but why is it a contraindication to tape DVT?
So remember I said to you guys, if you think about the picture that I showed, that the taping lifts the skin and it allows lymphatic drainage as well as blood flow. If you're going to encourage blood flow in that area, that DVT can start moving and it can lodge that clot. So that's why you don't strap over that DVT.
Okay. Yeah. Thank you. No question is silly and it's important to know. So thank you for that question. I'm going to give it a little bit to see if anyone else has any more questions. But as I was saying before, I'd like to thank SCT for making tonight possible. It was a product webinar and something different and something really interesting. So thank you so much. And thanks, Riali, for, like I said, a very interesting presentation, and to our audience for participating. So I hope that everyone has a great Friday and a wonderful weekend. And we will be back with more webinars. We'll keep you posted on email. So thanks so much and good night, everyone.
Good night. Thank you.
Thank you.